Well, welcome everyone. I am excited about today's webinar. Reflective activities are near and dear to me and really at the heart of our clinical education program at our institution, and I'm assuming at yours as well. So welcome. A little bit of housekeeping. My name is Matt Calandrolo. I serve as the Vice Chair at the National Consortium for Clinical Education. I'm a private practice owner in Connecticut and Mass, clinical partner with Springfield College, whom we'll be meeting here in a few moments. I'm joined by a few of my fellow NCCE board members, Lori Gussman from the University of Miami, Lisa Black from Creighton University, Jacqueline Carson from University of Montana, and Jamil from ACAPT has kind of been integral all in setting today's webinar up. So we are excited for this team. So where are we? What are we doing here? What is this? This is the NCCE Resource Sharing Webinar Series. It's a mouthful. I know we need like a catchier title for it, but that's what it is. It's our intention to bring real-time clinical education resources to the ClinEd community. Our plan is to do a half dozen next year, so 2022. This is our third to date this year, previously showcasing the University of Montana, the University of Kentucky, and now today, Springfield College. The idea was born of an idea that we had at the regional networking meeting last year at ELC. The idea was to bring real life examples and resources to the hands of those of us that need it the most, kind of the ClinEd community. So our hope is that you'll find some kind of gem today, bring it back to your departments, and start instituting some of these new reflective models. These will forever be stored on the ACAPT repository website, which has many useful ClinEd resources. I'll share that link. Actually, let me do some of that now. Lots of links there. So for those that are new to the NCCE, NCCE is part of ACAPT, and we're focused on clinical education. A gentle reminder that being an ACAPT member does not guarantee NCCE membership. For access to great resources like this one, please check the link in one of those links that I just put in the chat to see if your institution is in fact listed there. It's free, it's painless to join. If not, please reach out to Jamie Bayless. She's the NCCE secretary for details about membership and institutional pairs. Some final housekeeping. If you or your academic clinical partnership would like to share a resource at one of these kind of lunch and learn opportunities, please let me know. I would be happy to walk you through the process, and we're in fact looking for speakers for next year. So onto the main stage, the academic and clinical partnership of Springfield College and Live Every Day. Joining us today to speak is Kim Nowakowski. She has been an integral faculty member at Springfield College's PT department for years. She holds her GCS and serves as DCE for the program. She's also chair of the New England Consortium for Clinical Education. She works closely with students in a robust ICE program, IPE, and is passionate about falls and balance risk assessments, completing programs in IP and internationally in Trinidad and Tobago. So welcome, Kim. It's nice to see you. Abby Fagerholm, probably one of my favorite humans on the planet. She is a practicing physical therapist, clinical instructor, and director of mentorship. While fairly new to the CI role, she has hosted nearly countless students, 365 days a year, works within a 2-to-1 model, has succeeded in innovation throughout COVID with virtual student teaching, telehealth, and virtual community programs. She has embraced reflective activities with students and is anything but novice in her use of them. So welcome, Abby. Last bit of housekeeping. We're going to ask that you place questions to the presenters in the chat, and we'll pose them at the end just to kind of speed up the process as their time kind of runs. It's a lot to pack into an hour. So I'm going to turn the reins over to Abby and Kim to start us off on some resource sharing.
Thank you so much, Matt. So I will get started by sharing the presentation. I'm going to do a little bit of an introduction here and introduce the topic, and then it's going to move right into Abby, and she'll kind of discuss the meat. So we are going to talk today about some reflective frameworks and the importance of it being used. Oh, it would be helpful if I shared. I hate when that happens. I apologize. I got it up and then realized I was not sharing. There we go. Yeah, right. All right. So one of the first questions is really about reflective framework and why is it being used? So critical thinking, as most of us know, it's a really hard kind of thing to get students to do. They struggle a lot with the critical thinking, and just kind of, we as clinicians, especially experienced clinicians, get from A to Z really quickly. And the students are trying to still figure out how you got to C. So what we're presenting today and what Abby will really be presenting in the middle is the reflective framework. And it's really a way in which to facilitate critical thinking using reflection. When you first, so I work with the DPT 1s through DPT 3 students, when you first kind of talk about the concept of reflection, it's a really hard process to grasp. It's a really hard process for students to initially value in the beginning. A lot of times it's just reporting back or checking off the boxes. So it's really about trying to get them to value critical thinking and reflection as kind of going hand in hand to be this developmental process. It really requires practice. It just doesn't happen. Reflection just doesn't happen. We wish it would, but it doesn't. It takes a lot of work. It's formative, and it really requires some work to be intentional. So when we think about how we look at facilitating reflection and facilitating critical thinking, it requires those intentional questions that a CI might provide. We want to eventually make that student who is making that transition from student to professional to be a reflective practitioner. That's our goal. We should all be reflective practitioners, but it doesn't automatically happen when you graduate from PT school and get your NPT, pass the NPTE. So our job in this presentation is to present you with a reflective framework and try to get you thinking about how you as a clinician might facilitate that reflection and critical thinking process. So at this point, I'm going to turn it over to Abby. And Abby, when you want me to do the slides, just let me know.
Yeah, awesome. Thank you so much, Kim. Like Matt has said, like Kim just said, we are super, super passionate about reflection. And I think it shines just in our clinical partnership, but we use these frameworks a whole heck of a lot. And I'm really excited to be just talking them with you guys today. So what is the reflective framework? Really, it's a model that's going to guide someone through reflection. It's going to provide structured awareness and analysis that someone can engage in to just make themselves better and to do reflection, but do it purposefully. Reflection and clinical reasoning can feel kind of intangible at times for the student, and even for ourselves. It's something that's hard to, I think, describe, but the model is a way to systematically and purposefully do that, which I think is so, so, so important. There are lots of reflective models that exist out there. To name a few, there's the Gibbs model, there's the Schoen model. We picked the Rolfe model today, but I would encourage you guys to get out there and look at different models, because some of what you might end up using personally might just be something that is your preference towards the phrasing, towards how the model works. So there's a lot of models out there. We picked the Rolfe model today because I think it's pretty simple to work through. It's shown on the slide there. I'll get into that in a second, but we picked the Rolfe model because it's pretty simple to work through. It works nicely almost through like Bloom's taxonomy. So really you can be using it with any learners, and it's catchy, I think. So the Rolfe model is on the slide there. So what it really does is it works someone through the reflective process via prompting lines or questioning. So that what, so what, and now what, with the what being stems of questions that allow someone to identify basically that something has happened. You're aware of a situation, you've identified, yes, this is something that I should think about a little bit more. The so what takes that one step further, right? We engage in assessment, we engage in analysis of like the weight of what happened. We kind of think a little bit deeper, or the student thinks a little bit deeper about that. And then that now what becomes the synthesis or the formulation of a plan off of that, right? So whether it was a good thing, whether it was a bad thing that happened, by the time we get to the now what, we've reflected, and now ultimately we should have a plan going forward, whether that's to try and recreate something good that happened, whether that's to change something that we want there to be a different outcome. But we'll get to some of what those prompting questions will look like, but that's just kind of the bare bones of that model, which again, maybe feels like something that we just kind of naturally do, but for a student, might come a little bit less naturally, especially, being a clinical instructor, watching that in the clinic. It's hard for them to do that in real time or reflect on that. So that's just kind of how that model works. Like I said, it can really be implemented throughout a student's education. Usually it's the DCE or the clinical instructor that's going to initiate that and bring that to a student. So in our partnership, students are doing that very, very early on in ICE. As a clinical instructor, it's something that often we're prompting to the student a little bit less formally. And then more and more, as Kim said, our goal is that it can be provided more formally and then less formally so that the student can become independent in that. It's used in, and I think it can and should be used in all settings, both academically and clinically. And from a clinical standpoint, it can be used really in any setting because reflection itself is universal. And I think it's something that we all can hone and we can all improve upon. And it's definitely something that, you know, students should be introduced to early on and throughout their education. So here's an example of how we can kind of break out that model and provide a couple of questions that, you know, students can use. Actually, Kim, if you go back, perfect. So this chart is something that I think, again, puts some of those question stems to use. And you can use this in a very physical sense as almost like a handout or a way to provide physical questions for a student to use. You can also use something like this almost as a way to, you know, prompt your own questioning and learn how to better facilitate a student through that reflective process. Because I think a student is only as good at reflecting as they can see maybe you engaging in as a DCE, as a clinical instructor. So some of why I love a chart like this is it's helpful to walk yourself through A, your own reasoning process, and B, be a little bit more specific in how you're getting that student to that endpoint. So again, we can kind of see some of those questions in play a little bit more if you look at the different columns, right? So that what is just an identification of something. What happened? What did you see? What did you do? What changed? What went well? What didn't go well, right? So that really, really identification. That's so what, again, we take it one step further, we go a little bit deeper. What was the impact on the patient? Why does this outcome matter? What was your understanding of what happened? And then that now what and that formulation of a plan. So these are some examples of questions. I'm sure you can imagine how this could be a little bit more specific to an activity that you were doing with a student. It can be a little bit more broad in general. And I also like this because for a student learner, you can take these questions and make them really, really small or really, really big. So that student that's a little bit all over the place, kind of getting lost in their own thought process, can you take a really, really small question to start that reflective process? For that student that you're trying to open up and get them to talk a little bit more and get inside their brain, can you ask them like a really big question to start that reflective process? And again, wherever that student is in their own learning, you can work them through this model. So this chart, again, it's a tangible, it's something that you could manipulate so that you're providing it to students in a way, but it's also something that I think can foster our own learning and our own abilities to be reflective. So this was a pretty generic example. This next slide that Kim is going to pull up for me gets a little bit more specific. So there are a lot of words on this slide, but we'll talk through some of those words. As Matt said, I work in an outpatient orthopedic setting, and something that we always strive to do with students and a big goal of students is to be independent with an outpatient evaluation, you know, by the end of their experience, right? They want to be able to take that new patient and run them through an outpatient evaluation, which I think as a student can be a little bit daunting and it can feel kind of overwhelming and might be even a little bit overwhelming as a clinical instructor to take something and step back from it and say, wow, what just happened there? How am I going to help get this student to the next level with this? How am I going to help them take all these different components of something like this and reflect on them and make it better systematically? So via this model, I think it can help you to piece apart those pieces of something, some sort of activity like an evaluation, and help a student better be reflecting on it and making goals to systematically improve themselves. So again, if you're looking kind of at those columns, we see the what, the so, what, the now what. Those rows can kind of break out just like portions of the evaluation. And there's a lot that goes into an evaluation. So there's just a couple of examples. How was that student preparing for it? What were they physically doing during the evaluative piece? What did that plan of care look like? What was communicated to that patient? And again, we have just different ways that we can use those question stems. So if you look at that preparation, right, you can be asking a student, what were your working differentials? Somebody walked in, you knew they had back pain. What did you think was going to be walking through that door? So that might be a little bit of like a smaller and more controlled question. A bigger question, what did you physically do? What did you do to prepare for the evaluation? And then again, you can work them through that reflective model. So then maybe you think about how your preparation compared to how the patient aligns. You have that student identifying some holes in their preparation. And then they're starting to think about and reflect on, okay, the next patient that walks in with Achilles tendonitis, I'm going to make sure that I'm doing these things for them. So again, this is very, very specific. My bias is towards that, outpatient orthopedics, but you can, again, look at this model and think about how it can be used and applied to any number of resources. My clinical education team and myself, we are working on some clinical reasoning models and worksheets that we have as like tangibles, again, for the students to be filling out before, filling out afterwards. So you can, again, take a chart like this and mold it to be something that either a student is physically using to help with the reflective process, or maybe you're using it as a clinical instructor, as a DCE, to reflect on something that's happened and help a student better reflect and identify, you know what, I think where they were struggling was the evaluative portion of it. How am I going to help them recognize that and then get to a better place with it? So again, a lot of words that I think can be something formal, a little bit less formal, but really can be used in any setting, like we said.
So moving on from Abby to really think about, I know every time, we add something or we learn something new, a lot of times you think about, okay, how much work is it for me? Because it's already a lot of work to have a student. And I think it's about working smarter, not harder a lot of the times. So these reflective frameworks, and we'll have plenty of time for questions at the end, are really appropriate and applicable to all levels of students. So in our program as DCE, we start that reflective questioning really early on. They have 4 semesters of integrated clinical experiences before they go out to full times. And for every clinical experience that they go out on, we ask them some targeted reflection questions. And it was really through trial and error that we got to that, because at first we kind of had this open prompt like, oh, tell us about your experience. That didn't go very well because it was a checkbox and they kind of did a report of what happened during that hour. And now we're really kind of intentional. And, for each ICE experience, maybe it's not a ton of reflection questions, but they're really intentional to the experience. Like, what did you notice about safety when you were working in this chronic brain injury population? And really trying to get it to be active involvement of the student. If they're not taking ownership of the reflection in the critical thinking piece, it's not going to get any better, because if you ask them questions, they can give you the answer. But if they're not kind of showing you how they got to that answer, that's really what you want to see. You really want to see that thought process behind. So, in a non-structured one, you might just ask them, how did they get from A to Z? And some students can't handle that. So that's where that model about the what, so what, now what is really great. It's simple, can be used, and the student has to think, well, why is that important? What do I do now? That's really the piece. Like, okay, you have this information. Now what are you going to do? And it's that buy-in and that value, because reflection, speaking as a DCE and instituting it with our students early on, some students are great and are really good at reflecting. Other students, not so much. And you don't want it to be a check-off box. And we want them to be pretty good with reflection before they go out on full times. All of our clinicals are full-time terminal ones. So we have the opportunity or the luxury to kind of develop that process before they go out on clinicals. And then the clinicians can take it that much further and really apply it to each individual patient. So the hope would be that the involvement of the clinical instructor or the DCE should decrease over time. And like Abby said before, really important to think about, okay, given where the student is in their progression, do they need those small questions? Do they need the big questions? And if you think about the CPI, sometimes there can be a huge difference in items where they fall, perhaps in communication or exam versus procedural interventions. So you might choose really bigger questions for one area and then smaller for the other questions. So like I said, we use it for our integrated clinical experiences and really pose those targeted reflection questions. And it gives us an opportunity to kind of see where each student is as an individual. They post it to Brightspace, to the group discussion forum, and we encourage them to read others' reflections as part of a mentorship and kind of seeing where everybody's at so they can get a different perspective And what's really great is you can see how their reflections change from the beginning of the semester to the end, as well as that first semester to the fourth semester. And then for full-time clinical experiences, Abby touched on how they do it within their clinic. And we're very fortunate to have Live Every Day as a clinical partner. And a lot of this has kind of honed in together. We've looked at it, Live Every Day also takes our students for ICE and is a big part of our ICE program, our full-time program. So we've been able to kind of capture the importance of reflection and critical thinking. So our students will get to the point where this is just something that's expected of them, and it becomes a habit, and it becomes something hopefully they'll move forward with and become that reflective practitioner. And we need them to be independent. Independence just doesn't automatically occur, but it's really that targeted facilitation to get there. So really formative. And the nice thing that Abby talked about too was that, anyone can do it at any time, and kind of having a model that perhaps in your clinic that you work with, that all CIs are familiar with. It's a great way to have it be a formative process and not punitive, right? So that you're actually, this is what we do. And it's not like, oh, you had a bad day today, and now we're going to institute this process or this framework. So that's kind of something to think about as we start to think about, moving forward with formative processes throughout clinical education. So at this point in time, we kind of kept our presentation limited so that we could open up to questions, because I always feel like that's more important. So at this point, I am going to stop sharing and then be open for any questions.
One that was being posed, and I'll throw it out to kind of both of you guys, was how to provide, I'll say this, feedback and reflective model without either a student getting defensive and or person going down all the negatives that occurred during, in Abby's case, an evaluation or something of that nature. So how to avoid that defensive and that negative spiral that might happen.
Abby, you want to go first, or you want me to take this one?
I was going to say, maybe you take it first, speak to the educational piece, and then I'll speak to it in the clinic for sure.
Absolutely. So early on, it is kind of hard, right? It's part of that. Oftentimes students are perfectionists. Oftentimes they're often very hard on themselves, and it's about owning it and being accountable and kind of listening. And again, not making it that punitive process. So really using reflection. Sometimes it's just a fear of being wrong. That's really hard. And we're lifelong learners. So I always try to instill the students, I don't know everything. I know who to call and I know where to look for information, but really being accountable so that you can send them back. So it gets to that so what piece, and what do I do now? I think negativity isn't a good thing. It's not a way in which to start. But I think it's been hard with defensiveness, and it takes time and it takes persistence. And that's why, in a way, we started so early, because hopefully over time they're seeing that, they're being guided by our questions, they're seeing what other peers are doing, and they're out in the clinic for integrated clinicals, which is a great way to have it reinforced on the academic side as well as the clinic side. Abby?
Yeah, I would say I'll speak to as well a couple of things when I have a student that is defensive or is defensive about certain things. I think the reflective models are nice because sometimes I think a student is defensive when they don't feel like they have the answers, right? So maybe they can identify those things. And if we're talking about something negative or something that happened, right? Sometimes a student is defensive if they feel like they don't know how to fix it. It's easy to identify a problem if then you say, you know what? And here's my solution for that. And it's not always an easy solution, but I like the framework because ultimately your goal is to get them to a point where they can say, you know what, this happened, but I have a plan for that. And it's not that the student is going to be independent in that right off the bat. Maybe they need a little bit more help with that kind of second half of that model. Maybe you as the DCE or the clinical instructor are helping to provide that action plan off of it. But I think that's one of the things that I've seen is if a student feels overwhelmed or if they feel out of control, sometimes we get some of that defensiveness. So I like this because it provides them a little bit of control. It provides them ultimately with like a plan for the end of it. I will say too, I think even in speaking to it, my bias is to highlight some of those, the negatives, right? And say, when you didn't do something exactly well, if something went wrong, here's how you use the model. You can use the model for good things too. And I've found that as a CI, sometimes it's about balancing and helping that student recognize the good things that they did as well. So maybe you walk them through something that they could have done better, but maybe you're also that person that's pointing out something that went really well. You say, hey, you know what? You nailed it when you pulled this patient back and you introduced yourself. And that's not something you did before. Let's reflect on that. Let's think of how you got to that point and let's make sure we're replicating it because that was awesome, right? So I think these models, to Kim's point, if you use them enough, it's not something that's punitive and it can actually be something that you use to help bolster that student. So I think if it always is something that is negative, the student will feel negatively about it. It can be used for a positive as well, I would say. And that's maybe another way to help that defensive student is for you to point out and for you to highlight a reflective process on something that went well.
I think too, Abby, to think about like external feedback versus intrinsic feedback, right? Like students crave that external feedback because they've gotten it most of their academic career. So to kind of take those reflections, and yes, it's facilitated externally, especially initially, but hopefully they're going to develop that reflection and it's more of an internal process. And it's a great way to get that internal feedback, especially for students who lack some confidence, right? To use those models internally.
We do have some questions in the chat, ladies. The first one is, does the CI/DCE provide feedback to student reflections during ICE? And if so, how is that done? Verbally, on a discussion post? How would you suggest that be done?
So we have a reflection for every ICE experience, as I said. So students are required to post a reflection within 24 to 48 hours after, right? It lets it sit a little bit, and then they can write up their reflection. We review all the reflections. If there's something concerning or there's something that says to me, hey, that looks like a red flag for the future, I'll actually email that student and say, hey, let's make an appointment. Otherwise, what we do is we try to look at the themes, right? Because as we're all thinking, oh my God, how much time does that take? I have 45 students. They have yes, we read 500 reflections, right? Every semester, but you're playing catch up. But we have seminars throughout the integrated clinical experience each semester. So it's during those seminars that we kind of think about the themes and the things that we want to present. And we do a similar thing when the students are out on their full times. We have it moves from reflection to called professional conversations. And they pick the topics and they're just writing. But what it allows us to do is kind of take a pulse and see what's going on. And I can say we were hitting midterm last week and we started talking so we send what we call our Friendly Friday, but it's really just a post to the class, an announcement to the class that kind of says, hey, you're in midterm right now. How's it going with that shift from student to professional? And every week we've read the posts for that week, and it kind of prompts us to say, hey, they need a thought process. So yes, we read them. We don't do it individually unless warranted. Hopefully that helped.
Yes, I think so. We do have a couple more questions in the chat if you're ready for these. Mm-hmm. How's the amount of time to provide the appropriate individual feedback calculate into the DCE's contract? Does the DCE do all of the feedback work in the early stages of the student development?
So my ADC and yes, we do all the feedback. And we've tried to minimize time, right? It's not calculated in, it's part of the course. We're the coordinators of the course. So it's not, it's just kind of part of what you do. Fortunately for us, our ICE partners and our clinical partners who provide ICE experiences are wonderful. So, you know, they may email us if they see something that's a little bit concerning. We can always reach out to them if there's something we want them to look for. Our goal with ICE is to have that good partnership and really know our partners. So obviously not to put the burden on them. If there's anything that's concerning, we as DCE and ADC take over the issues.
I'm gonna just pose another question. Like, do you train your clinical instructors? I mean, obviously, Abby, you know, I mean, this is great, but how do you share this resource with clinical instructors that you're having the students do these reflections? You know, do you train them? Do the clinical instructors consistently read them at some point? You just said, you know, you do it as part of the course, but wouldn't this be valuable for the clinical instructors as well?
It would be, I think. And I think we will give feedback to clinical instructors sometimes about themes that we're seeing. I have met, when we start the ICE program, we kind of talk about with each clinical partner what their needs might be and what they can offer the student, and talk about different questioning models and things like that. It's just one piece, though, that we can take off of them. I'm also a CCIP trainer, so I know we talk about it within the course, and we try to promote that as well to as many of our CIs as possible. And we're happy to I've done in-services before for clinical sites, like managing the difficult student and reflection and how to ask questions. So really more on an individual, smaller basis, because our ICE sites too are usually within the hour radius, so they're close and they're strong clinical partners.
Abby, just to add to that, just in the clinical sense of how perhaps you're training other CIs in these types of models, how you're training other support staff, and/or I'm thinking even students, younger learners, that sort of thing.
Yeah, for sure. So it's something that having gone through and been to Springfield College myself, it's something that, you know, reflection was something that I was aware of pretty early on. I'm very, very lucky to work in a clinical setting with a partner that very much values it. But for sure, just like we're saying, a student doesn't walk out and become a reflective student. You don't just become a reflective clinician just because you say, I am now a reflective clinician. It takes time, and it takes goal setting, and it takes habit formation and good habit formation. So I think really all of this starts with the clinical instructor. So I think, the question becomes, how do we elevate clinical education, right? And how do we get to a point where a clinical instructor can take some of that ownership, right? And say, you know what, I'm going to be the person that helps to guide this student through a reflective process, because it's not just going to happen overnight. You're not just going to flip a switch with it. So it's something that my clin-ed team and myself were very passionate about it. So it's something that when we have meetings and when we meet on a weekly basis, it's something that we are constantly doing. It's something that we're constantly talking about, whether that's we're reflecting on our own performance of how we've done with students, or we're talking, how can we build some of that reflection and clinical reasoning with students? I think it's something that we as a clinical education team are talking a lot. And people who have been working with students more and more, I think, start to become a little bit more familiar with these processes. And then it's helpful to, when we have newer clinical instructors coming in, or when we have people who are guiding some of those ICE experiences in our clinic, it's something that we do, and we're hoping to more formally start to teach people these reflective processes. So having a lead CI that guides other CIs through how to use reflective processes and how to best instill that in the students. So we're always giving it to the students. It's something that we value as a clin-ed team. And as that continues to grow, as we touch more and more people, we're hoping to, just from a more structured standpoint, provide that to people.
Great. We do have in the chat box several questions. One is, can you give a few examples of targeted questions that you ask at the end of ICE experiences? at the end of ICEs?
Yeah, so sure. So the way our ICE is structured is that students will go out to a variety of clinical settings within a semester. Each student goes to each clinical site. So what we've done is attached a specific targeted reflection question to each site. For example, so I happen to be in a setting with patients with chronic brain injury, and I'll pose for the DPT ones who are new students, right? I'll probably, I'm writing that up today actually, but I'll probably pose a question like, what did you notice about safety that could be an issue in this setting? In the past, we've posted questions that say, given the article that you read, how could you use these tips for motivational interviewing when you interview your patient the next time? So really thinking about the what's, the so what's, and what will you do next time when you pose the question. And I think the key to that is that for every ICE experience that they go to, they're really only answering one reflective question so that they can be reflective. And it's got to be really thoughtful, because if I give them too many, it's a homework assignment. And that's what we noticed in the beginning. Like, it's a homework assignment and I'm just checking off the boxes. So really giving them that question that requires them to think. It's open-ended. It's not yes, no, which that in and of itself, anyone dealing with this age group too, my kids included, right? If I don't ask the right questions, I get yes or no. So really thinking about I think the question too, what questions do you choose? You think about, as the asker of the questions, what you want to get back, right? What's important to you? What are you trying to weed out from this experience? And that might help you to develop your question.
Actually, this one I think is going to be for you again, Kimberly, because this is more in the academic arena. Do you incorporate reflection following practical skills assessments in the academic courses that's similar to the clinical reflection process framework used on ICEs and full-time experiences?
So it's not as similar. We do incorporate a reflection piece. So once they complete their cumulative practical integrated exam at the end of the semester, we obviously are grading them. We also ask them questions about how they believe their performance went. And that's a great way when you go to meet with the student after this big cumulative practical to kind of say like, well, I, as the examiner, saw this, and you obviously perceived your performance differently. Or maybe they're right on the same page, but that helps us too, right? As looking at ICE and full times, where their perception of their skills are, right? Sometimes they think they're a great communicator, and I'm going, oh, no, we need a little work on that before you go out.
Thank you. It sounds like your audience is really wanting your opinions on the defensive student. So someone is asking, I would love further resources on helping students who struggle with defensiveness to feedback. So if you could, I don't know, throw anything out there regarding that defensive student.
I think being thoughtful about how you approach it. I'm just going to do anecdotally because it's off the top of my head right now, but I think being thoughtful about how you approach it and knowing your students. And I think being thoughtful about delivering it in the right environment and making sure that it's the right time. It's the right time in the right environment, right? You don't want them in the middle. I had to have a difficult conversation with a student last week. And my thought was, somebody said, well, why don't you do it at, 11 o'clock? Don't they have lunch break? And I was like, ooh, that's not really when you want to deliver that information, right? You want to maybe put it at the end of the day so that they can go back into the clinic. Thinking about the tone in which, watching your body language, watching your facial expression, and sometimes just starting with those reflective questions, I think it kind of links back, right? So what's going on? So now what do we do moving forward? And I think showing that there's some, give and take there, as opposed to just jumping in and being punitive. That's just off the top of my head. It sounds like that needs to be something like one of these.
I think you're right, Kim. Yeah. One final one, and then we'll wrap up as a group. And I guess back to you, Abby. I guess the burning question that's often asked of how does the clinical site afford the time, or where does this occur in a clinical experience or in ICE. So I guess how do you do it? Where do you place it within your clinical day? And I guess when and where does it happen?
Yes, everywhere. Can I say everywhere? Where does it happen? Everywhere, right? I think, I don't know. I think the onus always goes back on like you as the clinical instructor, you as the DCE, A, modeling reflective processes, and B, taking the time to understand these processes, because really this can happen very, very quickly, right? And when we talk about reflection, you know, we're thinking right now about reflection on action, which would be some sort of post activity, something that we say something has occurred and now we need to take that time to talk about it. Our ultimate goal would be reflection in action, right? So that's that, you know, you as a CI are watching a student go through an evaluation, you're like, holy smokes, why are they not doing X, Y, or Z with this patient? You know, this patient is angry, this patient needs to be positioned differently, right? So while we have those reflective processes that happen in action and happen in real time, that student might be lagging in some of those, but ultimately our goal would become that we develop reflection that's happening in action, so that student can make some of those real-time decisions. But where I use it would be, you know, at my clinical site, we do weekly meetings with the students. So if you have any sort of weekly meeting or scheduled meetings about goal setting, you know, as you're going through the clinical, or even with like, you know, CPI meetings, right? If the CPI is something that you're using, right? Those are perfect times, I think, to be instilling some of those reflective models. Depending on that student and depending on what kind of learner they are, you know, you can be very purposeful in pulling a student right after something that happens, you know, and giving that quick prompting, hey, what just happened there? Right? You steal like a minute in between patients, or maybe it's something that is more purposeful. And for that student that needs a little bit more guidance, you're saying, hey, you know what, every single night, I want you as the student to do a little bit of this write-up for me. And it doesn't have to be the longest thing in the world, but it can be a way for the student to then be engaging at that. So I don't know if that answers your question, but I think it's happening all the time. It should be happening all the time for just us. And I think it can be and should be worked into any sort of like weekly meetings that you have with students, and can be something that initially is happening as a result of an action, but that more and more is just becoming a process that the student is independently engaging in.
And I think Abby too mentioned a good part about the goals and starting to look at your performance and set goals. So we have students not only do the weekly goals during full times, but for ICE, they'll set goals before the semester and then look at them at the end of the semester and see if they met them, explain why or why they weren't met, and then make new goals for the next semester related to ICE. So it's been a nice way to kind of get them into that groove of, I'm going to assess my performance and make goals and try to figure out where I'm lacking, where are those gaps? Are they cognitive, psychomotor, or affective?
Great. Wonderful, wonderful, wonderful presentation, guys. Thank you so much. I'm going to repost a few things into our chat there, which gives us the contact information for Jamie, the Secretary of NCCE, and myself, should you be interested in joining NCCE and your institution is not a current member, or myself, if you have any ideas for future resource sharing webinars and or you'd like to participate in one actively, please do let me know. The next link listed on there is a direct link to ACAPT's repository for ClinEd resources. This in the future, PowerPoint as well as the presentation will be uploaded to that, as well as countless other resources are on there. You can also follow ACAPT's YouTube page, and that's a direct link for theirs, as well as the reflective model that's below. We do ask if you have a few moments remaining to fill out that survey, kind of give us some feedback of areas that we can improve and bring you new information going forward. But again, I want to thank you to Abby and to Kim and to presenting some of these reflective models. We appreciate it.
Thanks for having us.
Thank you.
That was great, you guys. Thank you so much. I want to just follow up with one word about volunteering to do this. You know, we have been so lucky with the NCCE and having these 3 resource sharing webinars, you know, fairly quickly. But we can only keep this up if we have more people out there that are willing to share with us. And we try to make it as easy as possible. You know, we're very friendly and very you know, try to answer all your questions and get you up here on the screen, because we know that every one of you in clinical education has something to share that makes your life easier, that makes things richer, that, you know, you've been doing this for a while, or you're brand new at it and you've discovered something new and you want to, you know, you're excited about it. This is where you're going to do it. Help us out.
Thank you, Lori.
You bet.